Good day, I'm Julio Atencio from Medellin, Colombia, and I want to show you this UltraPhaco cataract surgery that I performed. First, we performed the two paracentesis with 15-degree blade. Look that I only insert the tip and do lateral movement to get the measure that I want, 1 millimeter. Then I put the topical anesthesia, sugarcane, to maintain the dilatation and give more rigid to the iris to avoid floppy iris with lidocaine plus epinephrine without preservative free at 2%. Now I put some triplan blue. I routinely do it. I like to have good visualization, and the triplan blue gives more rigid to the anterior capsule to perform a better brexis. Then I fill the anterior chamber with dispersive viscoelastic and leave it with good tone to perform the main incision with a 2.8 millimeter blade. And in this case, I'm gonna do the scaff maneuver to open the anterior capsular bag with a center pinch of the anterior capsule with the blade in the same movement. Look that I only pinch in the center to open it, and then with the Ultrata forceps I perform the flap and then the resix. As you can see here, I do continuous circular movement, or we pull back to the center and grab it the time if you need it. In this case, I grab it 4 times, and always circular movement, always pulling to the center. That ensures you to have a good continuous circular rexis. I take out some of the visco to relieve the pressure and avoid capsular block with the hydro. So when I do the hydro dissection, I always have a medium tone of the eye. And when you see the liquid pass through the cataract, you know that is loose. Then I put some visco again because I'm going to insert the Ultrachopper. But I rotate. I always like to rotate a lot the nucleus with a small chopper to ensure that the cataract is loose, and I always release and make more easy the cortex step. Now you're gonna see the Ultrachopper tip. Look that the sleeve is covered 1 millimeter of the tip. That's to keep the 2 holes that the Ultrachopper have by the side inside the sleeve to have good irrigation and aspiration. In my second hand, I have the scaff nucleus sustainer to grab the cataract. I perform the Ultrachopper without ultrasound, just with mechanical movements. And if you can see, I go to the equator, grab the cataract, lift a little bit, and in the center, I chop with the Ultrachopper and the sustainer at the same time. I like to perform 4 quadrants, but you can do as many as you want. If the quadrant is smaller, it's more easy to the phaco to emulsificate the fragment. Then you change the tip. That takes about 1 minute, and put the Kelman tip and continue in my other hand with the scaff sustainer as a manipulator, and perform a standard phaco. Look here that I always keep the tip in the center of the eye. That's avoid problems. Always work as you can in the safety zone. in the center, and with the other hand you do the manipulation, the rotation, you help the fragments go to the tip to or make more chops to make the fragments smaller. And when you facemulsificate all the quadrants, you pass to epinucleus when you don't have that support of the cataract to avoid any surge or any keys to the posterior capsule, and finish the epinucleus fragmentification just to leave the cortex there. And now with the burato tip, I'm gonna perform the aspiration of the cortex. And look that I go grab the fragment, do lateral movement to release it, and pull back to the paracentesis, and in that zone, that's where you perform the aspiration. You go with a little aspiration, grab it, lateral movement, and pull back to the paracentesis. That's the safe way to avoid any traction to the sonul, any capsular back rupture, because in this step is when you get the more capsular back rupture. And when you perform 90 degrees, you only need to change your hands for the position of the irrigation and aspiration to do the other 90 degrees. In that way, you clean the entire back from cortex, and you have a good access to that fragment that is above the main incision, that is the more difficult to aspirate. And now I'm going to implant an acrifold lens. I perform this maneuver, the implantation of the lens, with only irrigation, so I keep the burato irrigation in the eye to give a tone and an open back, and I insert the lens. This lens is really easy to implant. You can maneuver really easy and accommodate it only with irrigation, and this save you to have to clean all the visco above the lens. Only you need to clean that what is in the front, that is just a little bit. And when you are sure you have all the eye clean, I like to finish my surgery with air and not hydrate the wounds. I prefer to dry it with a cotton. As you can see here, I put air to keep up a good tone on the eye, and then dry it with a cotton to close it. So that's it.